This is a brain surgeon that's done 7,000 brain surgeries in 11 years and is known as one of the top brain surgeons in the world. His name is Dr. Komotar, and he's an internationally recognized leader in the field of brain tumors. So the question is, how do you trust someone to save your life? What does it take to become a brain surgeon? And who are brain surgeons? Now let me take you back 6 years when I had a near-death experience having a seizure while driving. Now all I remember was waking up in the hospital, looking at my parents with the doctor saying, he needs brain surgery. We don't know why, but you guys need to talk to a brain surgeon. So today, we're not only gonna go into one, but two brain surgeries. And you're gonna see one day of one life.
Yo, what's up? Good to see you, brother.
Man? Good to meet
Everything
you.
good, man?
Good,
Awesome.
good.
Awesome to see you, man.
Dr. Komotar.
Time to see the other side, man.
Man.
Yeah, a big part of the day is physical activity. Always get about 200 weighted pull-ups in, depending on what the day holds.
So you're doing pull-ups before doing a brain surgery. Is this to like get the blood pumping, or?
It gets your mind right. I think working out before the surgery helps you focus, get your heart rate going. You know, we all have a lot of stuff going on, but you gotta be able to prioritize and focus. And we'll do about 20 sets of those throughout the day. Between both rooms, one of them is surgery for a motor strip glioma. So similar to what you had, right on the motor strip, so awake, so we can monitor movement so we don't hurt him. And then the other room is a benign meningioma, sphenoid wing meningioma.
Okay. And about 30 minutes later, he gets the call that it's time to go into the surgery room. And as I'm experiencing walking into the surgery room, it brings me back to the scene that I will never forget, being dragged into the surgery room, seeing doctors everywhere that are ready to cut into my brain.
Surgery is like zen. You know, you're not being bothered, no one's emailing, no one's texting you, you're doing what you love, you're with the residents and fellows. Like, doesn't get any better than that.
Now, what they told me before going into my brain surgery was, Logan, we're gonna be waking you up during the surgery to simply ask you questions to see if you can still speak or hear. Now, if you can, then we'll keep removing the tumor. And if you can't, then we'll have to cut the surgery short and leave whatever's left in there. This patient is about to have a tumor removed from the top of their head, which has to do with the area of the brain that controls your ability to move your arms. And if this patient can't move their arm in the middle of the surgery, they're gonna have to leave whatever is left in their brain.
These are surgical loops which help you with magnification. So these have the ability to magnify 3 times, 4 times, and 5 times, depending on the surgery. My go-to is 4, so I'll just leave it at 4 for this case. And then this is a surgical light that points a powerful light onto the field so I can see what I'm doing. This is a glioma, and it's right on the motor strip, so we have the patient awake, and then it's game time. Okay, now have them hold still. Meaning the area that controls movement on the left side. The white thing is the tumor, and they're side by side. So we have to take out the white thing while leaving the dark thing intact.
All right, LeBron, you're in surgery, okay? Everything's going great. I want you to stay still as possible, okay?
All right, once we get a good exam, then I want him to hold still on the left, and I'm going to stimulate.
Okay.
Moving his left leg and moving his left arm. 3, 2, 1.
Yep, he's moving.
Okay. Important to do it awake because the biggest risk of this surgery would be to cause weakness or paralysis on the left side. Perfect. So I was telling Sam and Victor, like the key here was like double checking over and over again. So the stim, the veins, the navi, everything has to kind of all go together. All right, cool. I'm gonna scrub in next door. Thanks, guys.
And 1 hour later, the surgery was complete. It could not have gone better, and the individual was stable and ready to recover. So how did all that go?
It's awesome.
Mission accomplished?
Mission accomplished. We had a great exam thanks to anesthesia. Can't do that case without good anesthesia. So patient was wide awake. We had a great exam. Like we talked about, that tumor was right on the area of the brain that controls movement, which is why it was so important to have that exam. And by the end of the case, we were looking at normal brain. We were getting reliable stims of hand movement. So we knew the tumor was just in front of that area, so as long as we got that positive stim, we knew that we had a complete resection, so it went great.
Life changed. All right, so we're gonna go and give the good news that the surgery went perfectly well. So let's see what happens.
Sacamos el tumor entero, no había complicaciones. Sacamos todo al fin del caso, se veía limpio. Y él está perfecto, está moviendo, no tiene complicaciones. Lo puedes ver dentro de 1 o 2 horas en el cuidado intensivo en el 5º piso, pero lo vamos a observar esta noche y a casa mañana. Actividad completamente normal.
So how do you feel now that he just heard great news, gave a hug, like?
I mean, that's the best part of the job, right? We love being in the operating room. We love advancing the field, but having someone like that where you know that you changed that patient's life and their entire family forever, it's the reason why it's the best job in the world.
Now after this surgery, before we went to the second surgery, we went and stopped and had lunch.
Solamente estos 3, por favor.
And as we're going into the second surgery, Dr. Komotar is carrying his speaker. And as I see him carrying his speaker, I'm thinking, okay, what is he gonna do with a speaker during a brain surgery?
Ooh. If the patient's not awake, then I always gotta have music in the OR.
Does this help you focus more?
100%. Some people find it distracting. I can't imagine why. We'll do a little Busta Rhymes. I'm feeling Busta Rhymes today.
You're getting stomped by the marching band. People shook like spray cans. It's so hot it'll make your face tan. Ace band rap the place to wasteland. Bitch all in my mouth, but it tastes bland. I feel fake niggas amidst these snake niggas a hiss for one bite. False alarm, and if it don't rock, while we finna drop.
People on the street would think that a neurosurgeon has to have the most still hands, the most incredible hand-eye dexterity. And yes, you need to have a baseline. You can't be a clown. Just like you heard, judgment, level-headedness, and I would say discipline. The ability to make a decision, go with it, stick by your commitments, and not make excuses, I think that is absolutely paramount.
And that was the tumor?
This right here, this was the tumor. So you have arteries that are attached to the tumor that you have to remove delicately, and if you injure those arteries, you can cause a stroke. Hey, is this Tammy? Hey, how are you? It's Dr. Komotar from the University of Miami. Good, just letting you know everything went terrific on your mother. The tumor came out beautifully, no problems. It looked totally benign. So she should be upstairs up in the neuro ICU, 5th floor. You could see her in about an hour or so, and then we'll watch her overnight and get her home tomorrow. So yeah, then of course during the course of the day, there's the usual like 17 million emails and 5,000 texts and stuff. So
crazy.
You got to answer that stuff in between surgeries as you're walking to clinic, as you're walking around, because.
All right, so we're now at the clinic. Surgeries are done. Lunch is done. What are we doing here?
So this is where we see new patients, old patients, follow-up patients, post-op patients, see how they're doing, talk about pathology, what the next steps are, what the follow-up is, if there is any follow-up, and patients can see me basically within 1 or 2 days. I have clinic 5 days a week, so that if a patient gets a newly diagnosed brain tumor and they want to see me, they don't have to wait a week. Because you can imagine the anguish of having a new diagnosis and not being able to see a doctor. So we see everyone right away. We fit in the clinic in between the surgeries so that people can get seen quickly, get booked for surgery should they need it, or at least speak to a doctor so that they're more calm about their diagnosis.
Yeah. You showed us one day of your one life and you saved 2 lives.
It was an awesome day. It was great having you guys. If you love what you do, it shouldn't be work. It should be fun. It should be something enjoyable. And then if you enjoy it and you're good at it and you're talented and you're disciplined, the sky's the limit.
Yeah.
Being around people like Dr. Komotar is a great example of somebody who took one risk in one day to focus on one goal to create the one life that he desires. So the question is, what's the one decision that you can make in one day to create the one life that you desire?
Man, dude, thank you so much.
Always, man.
Amazing, amazing.
Dude, awesome seeing you.
Yeah.
All right.
More
We'll
to
talk
come.
soon, man. Thanks for including me.
Yeah,
Should be
dude.
great.
Cheers.